things that contribute to anxiety, I think the first is dealing with a life-threatening illness. So cancer in our culture has I think this life or death kind of tone about it, that's the first thing people think, even though many other illnesses are actually equally or more dangerous. So I think the first thing is just dealing with the possibility of dying and that. I think there's anxiety about the uncertainty of the future. What will happen? Will they be okay? Will they die? A lot of people have anxiety about the impact of the illness on their family, and what will happen if they should die, or what the impact of caring for them during this illness is. I think people also have anxiety when they're actually doing quite well. They've completed a course of treatment for cancer. They're feeling fine, but it's how do they put their lives back together after having been through this challenging experience. And then I think there are a number of things depending on people's social lives, how they interact with friends, how they interact with colleagues. For people who have children, there are concerns in particular about the impact of the disease on their children. And then I think people at the end of their lives, there are often some very specific concerns about, and actually this is true throughout the course of the illness, if they are going to die, what will that be like? Depending on their spiritual beliefs, there can be spiritual concerns. Probably the strategies to manage anxiety are really the same through the course of the illness. And they're two separate things. I think one is the personality of the person and how people best manage anxiety. And the other are the specific strategies that you can use to manage anxiety. So related to personality, I think people fall into two broad groups. And one is people who find it most helpful to spend some time thinking about what's making them concerned. For example, thinking about the possibility of dying, or thinking about what it would mean to go back to work, and thinking about the things they're worried about. For other people dealing with anxiety, it's actually most helpful for them to focus on the belief that everything will work out well, and not to spend time thinking about the things that concern them. So I think part of it's adapting the strategy to what's most helpful to the person. And then as far as the techniques go, and again these work I think through all stages, a certain part of it is distraction from the anxiety, finding ways to focus on meaningful things in life other than the things that are making you anxious. And then the other is almost the opposite, is taking the things that are making you anxious and saying, if these things are going to happen, how can I deal with them constructively and in a meaningful way? And then some of it's looking at at things that you're anxious about and finding strategies for managing it. So, for example, if you're anxious about being in the hospital, how can we find strategies to help you manage the time you'll be spending in the hospital? And then I think the other thing is managing within a family the different styles that people have for dealing with anxiety. So a very common situation is one person, let's just take a married couple, the person will say, I'm really worried about what's going to happen in the future. And this could be the patient or the family member. So I'm really worried about what's going to happen. The other person is saying, it's going to be just fine. Don't worry about it. So one of the things I do is try to help family members find ways to accommodate how these different styles of managing anxiety. I'll start by saying when people think about a life-threatening illness, the emotion that you most hear people talk about is depression. This is in the general literature, not among the people I work with. And you see very little written about anxiety. Whereas when I deal with patients, actually I think anxiety is the thing that's most prevalent because there's so much uncertainty about the future. So I think it's way more prevalent than depression, and it's often unexpected. People don't think about that. And then I think one of the interesting things that related to anxiety and depression is that there's a theory that, if we're talking about clinical depression, that's actually anxiety precedes clinical depression, that people shut down emotionally because things are so overwhelming. So these two, I think, actually do relate. But again, I actually don't see a lot of depression in cancer patients. I see anxiety and I see sadness. And I think the sadness is about the various changes and losses which have occurred or which might occur. So almost everyone, they will just describe this horrifying moment when life changed. And there's a before and an after, and almost everybody can describe that scene in great detail. And I think it's because in this culture, cancer is associated with dying. So it's almost immediately people think they're going to die. The other thing that's almost immediately comes with the anxiety is they expect to die a very painful death. So anxiety and death and pain are associated together. So that's a really interesting question. So the question is, does anxiety change over the course of an illness? I think the idea is one that we might have stages of dealing with anxiety. So there's this Kubler-Ross idea about the stages of dealing with death and dying, and it goes through, shock and denial through to acceptance. So it turns out that theory about dying is not accurate, that we actually don't go through very discrete stages of dealing with death, that actually at almost every stage, all of these things that Kubler-Ross mentioned occur in different, sometimes simultaneously and sometimes sequentially. So you can actually have acceptance on the day you're diagnosed and go, okay, this is hard, but I'm going to do it. And then as you get closer to death, it would be going, oh no, I don't like this at all. I don't think I like this. I'm not doing it. So I think the idea that these things occur in very discrete stages is not accurate in terms of facing death. But I think also with anxiety, just like having cancer, I think almost throughout all of it, you're experiencing this back and forth between this is frightening, this is how I'm going to deal with it. This is frightening, this is how I'm going to deal with it. And things may change in the beginning. Oddly enough, the beginning is frightening. Going through treatment, which you would think would be very anxiety arousing, and it is sort of, but the nice thing about it is you have a nice, neat set of tasks to do. Just show up, get the treatment, be around doctors and nurses and people who are giving you a lot of support. And so it's a very structured lifestyle, and that anxiety actually often increases when this treatment ends and your life is now unstructured and you've got to face, how do I rebuild my life without this kind of neat, organized set of events? And then you can kind of to that, and life goes on normally. But then a year later, when you're having scans to be surveillance scans for the disease, it's almost like the initial anxiety of the diagnosis coming back all over again. Oh my gosh, this could happen all over again. And so things don't change in nice, neat sequences. I think people do find that the skills they learn to manage anxiety early in an illness help as the illness progresses. But they're not nice, neat things. And the same thing I think in terms of acceptance. People accept the possibility of dying from the very beginning through the end, and that possibility is also terribly frightening and distressing from the beginning to